Carrie is a first-time mother caring for her new baby boy. She notices that as she touches his cheek, he turns towards that side and opens his mouth. The nurse tells Gary that this is a reflex called dash. A. Plantar grasp. B. The rooting reflex. C. Palmar grasp. D. The Moore reflex. E. The Babinski reflex. The answer is B. The rooting reflex. The question describes the rooting reflex. The Moore reflex is shown when an infant is startled and or feels loss of support as if he or she is falling. He or she will extend the arms above the body in a curved shape. The Babinski reflex occurs in response to stimulation of the sole of the foot. Typically, the large toe will extend or remain extended as the others move. Infants may also exhibit plantar grasp with application of pressure to the foot. In plantar grasp, the toes will flex inward. Infants displaying palmar grasp will close their fingers around an object placed in their hand. Which of the following findings are abnormal upon assessment of an infant on the third day of life? A. Mottled skin. B. Firm stools. C. Blue tint to the hands and feet. D. Fine hair covering large body surfaces. E. Small, white spots present on the bridge of the nose. The answer is B. Firm stools. Hard or firm stools are abnormal for an infant on their third day of life. Typically, infants will have meconium, dark, sticky, stools for the first several days as a result of amniotic fluid ingestion. Over the next couple days they will transition to a seedy yellow, breastfed infants, or peanut butter consistency, formula-fed infants. Acrocynosis, blue color on the extremities, is normal in infants. Mottling is also common. Infants have a developing cardiovascular system and many capillaries that exist close to the surface of the skin. Milia are normal white spots that frequent the faces of newborns. It is important not to pick or scratch these white spots to prevent scarring. Infants are also frequently born with fine hair called lanigo covering the body's surfaces. Some babies may be born with more lanigo than others. While assessing a 4-month-old infant, the nurse notices hyperpigmented nevi on the lower back. Which of the following is false regarding hyperpigmented nevi? A. Hyperpigmented nevi fade over time. B. Hyperpigmented nevi are most commonly found on dark-skinned children. C. Hyperpigmented nevi are frequently mistaken as bruises. D. Hyperpigmented nevi may be scattered. E. Hyperpigmented nevi may be associated with Sturge-Weber syndrome. The answer is E. Hyperpigmented nevi may be associated with Sturge-Weber syndrome. Hyperpigmented nevi have been previously called Mongolian spots. They occur most commonly in dark-skinned children and fade as the child ages. They are often mistaken for bruises. Sturge-Weber syndrome is a neurological disorder which is present at birth and associated with port wine stain birthmarks. While using an otoscope, how does the practitioner correctly examine the tympanic membrane of a toddler? A. Pull back on the upper pinna. B. Pull forward on the upper pinna. C. Pull down on the earlobe. D. Pull upwards on the earlobe. E. Pull up on the upper pinna. The answer is C. Pull down on the earlobe. Examine the eardrum of infants and toddlers by pulling down on the earlobe. Examine the eardrum of an older child by pulling up on the outer pinna. Additional help from colleagues or caregivers may be necessary when examining small or upset children. Rubeola is caused by which of the following viruses? A. Varicella zoster. B. Measles. C. Human herpes virus. D. Coxsackie virus A16. E. Parvovirus B19. The answer is B. Measles. Rubeola is caused by the measles virus and is extremely contagious. Airborne precautions must be used when measles are suspected. Patients who are affected by measles may exhibit a high fever, cough, conjunctivitis and a rash among many other symptoms. Contraction of measles may be prevented by administration of MMR, measles, mumps, and rubella, through vaccination. Human herpes virus include a family of related viruses of which varicella, zoster virus, causes chickenpox and shingles, is a member. Parvovirus B19 may cause fifth disease, among other conditions. Coxsackie virus A16 causes hand-foot-mouth disease.